There to give CPR. The ambulance driver was driving, the patient was on the back side. See, and even if attendants are there, even if some people are there, if they don't know how to give CPR, when to give CPR, there is no point in that. Okay, so basic life support is of utmost importance. So how to do CPR? All these things will come in detail. Just I'm telling in short regarding all these things. Patient is lying on the floor. Mostly they'll be lying on the floor. Kneel down to the patient. Okay, kneel down at the level of the patient, and cross your fingers like this. Okay, with the elbows extended, never with the elbows flexed. You can. This is the sternum. Center bone will be there now. Lower part of the sternum towards the left. You can place your fingers like this. Lean forward and do compressions like this. Okay. How fast you will do? 100 to 120 compressions per minute you can do. Okay, not too fast. The main thing is while doing compression, some people will be doing like this. If you do like this, what will happen? See, after compressing, you should allow the chest to come back. At that time only heart will receive the blood. Then you are pumping the blood to the brain. So make sure it's not more than 100 to 120 and not less than that also. Okay. Ideally, it should be 1/3 of the depth of the yes, and AP diameter. Okay, it should be 1/3 of the depth of the anterior diameter. Next, the best thing is like we'll say push hard, push fast. It is advised to give breath, 2 breaths. But if you are outside, you can't give mouth-to-mouth breath. Leave it. No need. Okay. But chest compressions, there should not be any interruption. You can pinch him on the hand. He might respond. That is response to pain. And next category is getting completely unconscious. And the most stable patient will be alert patient, not getting patient who is conscious. Okay. Regarding the pulse, I have told you. Regarding the breathing pattern, I have told you. So next thing is how to drag a patient. That also I have told you. So make sure you drag him along the longitudinal axis of the body. Understood, right? Never drag him sideways. Always drag him. And make sure if in case of a fall, if someone has fallen from a height, there is high chance that he has he would have had a cervical spine injury. So if the spine is injured, there is spinal cord behind that. Okay, if you move the patient, if you manipulate the patient in such a way that the spinal cord is injured again, if the already a fractured fragment is there, if that pokes into the spinal cord, he will land up in permanent paralysis of the upper limb and lower limb, especially of the upper limb. Okay, that would be a very dreadful situation. So what you can do, make sure if someone is there to help, make sure you grab him on the side. Okay, make sure you stabilize. So first thing, check for response, no response. Check for pulse, no breathing, start CPR. And while doing CPR, in earlier situations we used to say respirations. Okay, 30 compressions we have to do. The usual protocol you have to follow. Check for response. Okay, no response. Check for pulse, no breathing, start CPR. But in case of drowning, see, any case, anyone getting into a state of unconsciousness, there will be a cause. Okay. There can be a number of causes. It can be due to sodium or potassium getting altered. High potassium can suddenly stop the heart. Okay. Hypoxia we used to say, lungs, increased lungs, water is there. Okay. So that is causing hypoxia. What do you say? Lack of oxygen in the body. That will trigger another cardiac arrest. In that case, what you can do? In case of drowning, first we are supposed to give 2 breaths. That go outside hospital, it's not possible. Then you can start the CPR. If you want to also CPR is the most important.